My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and I empower people with Medicare insurance knowledge. In this video, I'm going to go over the benefits of Medicare Supplement Plan G and the outlook for the rate stability of Plan G. Medicare Supplement Plan G is a true Medicare supplement plan. It's also called Medigap Plan G. The way it works is you'll keep your Medicare benefits. So Medicare A and B will be your primary insurance provider, so you'll continue paying your Part B premium to Medicare. In return, with Plan G, because Medicare is your primary, you can go to any doctor, any hospital in the country that accepts Medicare. So you have nationwide coverage, you don't have to get any referrals or prior authorization. As long as the provider accepts Medicare, they'll take your Plan G. It doesn't matter who the carrier is, as long as they take Medicare, they'll take your Plan G. As far as the benefits go, it's very simple. As Medicare is your primary, so Medicare would normally charge you some out-of-pocket costs. But with Plan G, you only have to pay one of those out-of-pocket costs before everything else is paid, which is the Medicare Part B deductible. In 2018, currently, the Part B deductible is $183. So once you pay that $183, the Plan G is going to pay the remaining of your out-of-pocket costs for Medicare-covered services. Here's a couple of examples. If you go to the hospital, Medicare is going to charge you around $1,500. Well, if you have Plan G, it's going to pay that $1,500 for you every single time. So whether you go to the hospital once or you go 5 times, if you have Plan G, you'll never have a bill. If you're there a week or you're there 150 days, Plan G is going to pay all your hospital bills. Now for Part B services like doctor visits, lab work, outpatient procedures like knee replacements or cataract surgeries, Medicare is going to require that you pay that $183 deductible. Once you pay that deductible, the Plan G is going to pay the 20%, so you won't have any other costs. A question I get is, Bob, is that $183 deductible per service? The answer is no. The $183 is a per year annual deductible. So you might go to the doctor in January and pay $100 of it, and then you might go for another service in March and pay the remaining $83. They don't have to be the same service. Once you have spent $183, your deductible is met, and Medicare will pay 80%, and your Plan G will pay the remaining 20%. As far as stability goes, I call Medicare Supplement Plan G greatest value. And I do that when I'm comparing it to another plan called Plan F. With Plan G, the stability of the rate increases over the last 5 years have been much lower than Plan F. The outlook for Plan G is also brighter. So we are seeing stable rate increases with Plan G, and that's because certain requirements that people have to medically qualify for G, that G is still going to be offered to 65-year-olds past 2020, and I go into more depth into this in some other videos. So that's Medicare Supplement Plan G. I call it greatest value. Once you pay the $183 deductible, Medicare is going to pay 80%, Plan G pays the remaining 20%, so you have no more out-of-pocket costs. Medicare is still your primary, so you'll pay your premium to Medicare, and in return you have nationwide coverage. You can go to any doctor, any hospital, any provider that accepts Medicare, and the only out-of-pocket cost you'll have is at $183. You never have to get any referrals. You don't have to get any prior authorizations. You are covered nationwide. And as far as stability goes, we've already seen it over the last 5 years. Plan G has had low single-digit rate increases with most carriers, and I anticipate that to continue.